Welcome to part 2 of our tips. We're doing tips on how to do well in anesthesia or how to pass in anesthesia. Guys, I don't know if other universities they do ask this, but UP loves it. So if you are in UP, make sure that you listen to what I'm gonna say now. You know, the monitor in the anesthetic machine, there's a monitor that is full of numbers that make it your friend. Whenever you get a chance, take pictures of that for different cases. Whenever they do a GA, go and take a picture. Go and sit down with it and look at it. Go through it. So that when exams come, they ask questions, at least you'll have an idea where to find what. Because, I mean, they can give you, especially when you are doing your OSCE, they can show you a screen and then they say, what's the weight of this patient? The thing is that on that screen, there's no weight. So the thing that is there is the tidal volume, which means now you need to calculate the weight from the tidal volume and go back. So if I do a retro calculation to find the weight of the patient, obviously the weight that you're going to find is going to be a range. Remember, the tidal volume has got a range. I think it's 6 mils per kg, 6 to 8 mils per kg. So it means you're going to calculate for 6, calculate for 8. So the answer that you're going to give them is going to be a range as well. The weight is going to be in a range. They can also ask you, they can even ask you, so know how to calculate. Whatever that needs to be calculated, just know about it. They can also ask you, they can say comment on the end-tidal CO2. If you don't know where to find end-tidal CO2 on that machine, you're going to struggle. They can also ask you to, then they can also ask you to mention the gas that is used in this patient. Then you need to check, you need to know where to check to find out if it's SIVO or if it's isoflurane. They can also ask and say, what's the make of the gas that is being used? So you must know where to find the make on the machine. You must know where to find the end-tidal SIVO if they've used SIVO, end-tidal ISO if they've used ISO. And I know that machine can be overwhelming, but it has to be, you have to make it your friend. They can ask anything on that machine. So make sure that you are, they also can ask you about the flow, calculate the percentages of the flow. If the total flow is like this, how much of each gas, what is the percentage of the gas given? Some of the things you don't need to even calculate, you can just look and then you go and write it. So, but you can't do that if you're not used to looking at that machine. Learn to look at that machine. Get used to looking at that machine. That's number one. Number two, when you are given a scenario, they also like to do this. They will give you a scenario and say, okay, we've got a patient, a 35-year-old patient, step abdomen, who's got these blood pressures. When you look at those blood pressures, we find that they are low. The patient has got tachycardia. So which means the patient's got is hemodynamically unstable. Then they will ask you, what's your approach to the anesthetic of this patient? What they want you to mention there, it's a step abdomen. Unlike that, it's an emergency. So which means that patient is unfasted. So the first thing that's going to be done is going to be a rapid sequence, and the drug of induction there is going to be etomidate because it's the one that is known to be hemodynamically stable. So look at the scenario, read it, and try to point and see. The fact that they say it's an emergency, it's a step, they are saying rapid sequence. That's the first thing. When they give you they won't tell you the patient is unstable, they'll just give you blood pressures. Look at the blood pressures and decide this patient has got shock or is hypotensive. Then you know that you're not going to use proper form. I've seen people use propofol on an unstable patient, hemodynamically unstable patient. Those are the people who are experienced, who know that they will deal with the hypertension. It's okay, but they will still induce with propofol. But in terms of literature, it's intermediate. Yes, you can use propofol, but for us who are still learning, we would say intermediate. And and appreciate things like that, and also appreciate if, for instance, let's say they want to trick you, then they say, we've got two patients, 25-year-old patient. One has got an abscess in the neck, and then the other one has got needs to go for amputation of the leg. They are both 25, no comorbidities. Then they ask you, what's your approach in trial on this patient? So the difference is that this one has got a neck in the abscess. Neck in the abscess. I'm tired, guys. This one has got an abscess in the neck, so it's gonna be GA with that one. But the one who's gonna be done in amputation, and especially if the amputation is like an elective, there's nothing emergency about it, so it's gonna be done as spinal. So whether you're gonna do a spinal or GA, let's first say this: for all pediatric population, it's almost always a GA. So you don't have to get confused about that. But now for the adult population, whether it's a GA or a spinal, it depends on a couple of things. The nature of the procedure, where is the operation, where is the surgical field, what is it that the surgeon is gonna be doing, in what part of the body. Upper part of the body, most of the times it's a GA. If you wanna guess, most of the time it's a GA. Then lower part there, it can be a spinal. So if you are not sure, they tell about prostate, whatever, or whatever, abscess, IND in the buttocks, things like that, down there. If you're not sure, just go towards a spinal. But for things that are in the chest going up, just talk about GA there. So what I think did I want to say? So it's important to know the calculations, know how to calculate know how to estimate the weight of the baby, and know how to calculate the size of the tube, and know the differences between a calf, the advantages between a calf and an uncuffed ET tube. Another thing, know all those equipment. Spend time in theater, go and look at those equipment. I know that if you are in UP, they will show you an equipment. They will ask you what is it, when is it used, especially for those patients. Know the different types of ET tubes. They like to ask them, the reinforced ones and all of that. Know those things. They like to ask them. And yeah, it's important, guys. And you know the different blades, the Macintosh, the Miller, you must know them. When to use which one. They are the equipment, just know it. I know it's not nice, but just know the equipment. They like to ask it. I think that's it, guys, when it comes to the tips. Let me sleep now. It's like 12 o'clock. Thank you so much.